So this is the emergency theatre. This is not the theatre you'll be coming into if you were having an elective caesarean, but everything in here is very similar. The equipment that we have is exactly the same. So when you come into theatre, there will be a lot of people around. There will be the anaesthetist you already know. There will be an anaesthetic assistant who works with the anaesthetist. There will be 3 scrub staff. One of the staff members will already be scrubbed and will be setting up the instruments, which I'll show you where they're going to be in a minute. The other 2 staff will be helping the anaesthetist and helping the scrub nurse. We will have the midwife, who you will already know, who will come into theatre with you. And then when we get started with the operation, you will have the 2 surgeons. So there looks like there's an awful lot of people in theatres, but everybody has their job. When you come into theatre, you will be walking around to the other side of the table. We'll have a step here ready for you. You'll step up on the step and you'll sit on the table facing this way. The anaesthetist and the anaesthetic assistant will be behind you. They'll get you hooked up to all of our equipment, so all the cables that you can see. You'll have a blood pressure cuff on your arm, which will go up periodically throughout your whole stay in theatres. You'll have a peg on your finger, which will measure your oxygen levels, and you will have an IV drip going into your arm, giving you fluids. This is normal for everybody, and it's all perfectly safe. So once the anaesthetist has all their equipment ready, they will warn you what's going to happen, because as I said before, they are behind you. So they will let you know if there's going to be anything cold on your skin, anything sharp on your skin, and they will let you know what to expect as they're going along. If you want more details, please feel free to ask. You can always ask questions while you're here. The anaesthetist will then go ahead and insert the spinal anaesthetic. It takes roughly about 5 to 10 minutes to do that, and they will ask you questions all the way through to say what you can feel, where you can feel it, and where exactly it is on your body, so they know where they're going. It's a very fine needle that they use, but they have to get it into the right place. So the communication from you is always very helpful. Once the anaesthetic's in, they will tell you that you'll start to feel it working straight away. You normally get a hot bottom, which is what we always warn people about. That's all perfectly normal. The anaesthetist will then take the drapes off your back and will swing your legs up onto the theatre bed so you're lying flat on your back. As you know, during pregnancy we don't recommend you lie flat on your back, so the table will be tilted very, very slightly so baby bump just goes off any major vessels, so you shouldn't feel uncomfortable at all. You may feel it very strange, you will not fall off the bed. So once you're lying down on the table and you're feeling comfortable, your partner, whoever your birthing partner is, will be walking around from this side of the table. They'll go all the way around and they'll sit on the stool at the top of the table next to your head. One of the scrub staff will then prepare to put in a catheter. As I say, there's a lot of people in theatres. We will keep you covered as much as we possibly can, and we will be as discreet as we can when we put the catheter in. You won't feel anything uncomfortable as the catheter goes in because your spinal anaesthetic will already be working. You will just feel touch and movement. Once that's in, your legs will go flat. We've got some drapes to put around your lovely stockings that you'll have on your legs to keep your stockings dry. And then we will put a strap across your legs. As I said before, the table is slightly tilted. Once you lose the feeling in your leg, there's a good chance when we tilt the table, it'll just roll off the side. So we put a strap across just to keep you safe. We're then ready for testing your spinal to see if the numbness has come up high enough for you to have your operation. The anaesthetist will do the testing. They do the testing with a cold stick, and they will test all the way up one side with the cold stick, and then they'll test all the way up the other side with the cold stick. Nothing will start until the anaesthetist is happy that your spinal is in and working properly. So it's normally at this stage that the surgeon and the surgeon's assistant arrives. The scrub nurse will have the tray ready with all the equipment on, and they will have turned the table and will be standing here throughout the procedure. The surgeon will arrive, they'll get washed and scrubbed, so they'll come in with their gown and their mask and their gloves on ready. We'll then do a final check in theatres, and this is where we check that we have the right person with the right information on your bracelet, and that everybody knows of any allergies, any metalware, all that sort of thing will be checked now before we start anything. So we will then check with the anaesthetist that they're happy with your block before we start, and the surgeon will come and prepare your abdomen for surgery. It's a very cold prep that they put on your abdomen, but because of the spinal you won't feel cold, you'll just feel movement. So you'll feel a brushing sensation across your tummy as they prep. At this stage your partner is still sat at the top with you. Once the prep's on, we have to wait for the prep to dry. It's an alcohol-based prep, so you will smell the alcohol, and we wait until that evaporates off your tummy before we put any drapes on. So once your abdomen is dry, the drapes will go on and the big screen will come up with a drip stand either side to hold it in place. You and your partner will be behind the screen, so you won't be able to see anything that's happening down here. With you at the top, you'll also have your anaesthetist at all times, and the anaesthetic assistant will be with you as well, so that if you have any questions, anything that's worrying you at that time, there is somebody there to ask. We will have music in theatre, because this is where you need a nice relaxing environment, so the music will be playing. If you want to bring your own music to theatre, please feel free. We love it when people bring their own music and we can hear their taste in music. So once baby's delivered, we then practice the 1 minute cord clamping. So you'll hear your baby cry, and we'll be giving your baby a good old rub while this baby is still on the table with you. Then the surgeon will clamp and cut the cord and pass the baby off to the midwife. So at that stage, the midwife will take over care of the baby. As long as everything's fine, they will bring the baby up to you and you'll be offered skin to skin, which is a lovely time for you and your partner to share with the baby. If you've got your phone with you, you can take photographs, and I'm sure there'll be somebody nearby who will be happy to take a photograph of the three of you at that time. Once we get towards the end of the procedure, you'll hear the scrub staff counting. We do 3 counts throughout the procedure, so you'll hear those going ahead. And once we've done the 3 counts of all of our equipment, then a final check will be made. Once that final check's made, the midwife will take baby and your birthing partner out of the theatre and take them through to recovery, where they'll be waiting for you. It's then time for us to get you off the bed, get you nice and cleaned up in a nice warm bed, sat up, and then you'll be wheeled in to join your partner and baby in recovery. Okay, so this is recovery, and this is where you'll be coming to after you've had your baby. Your partner and baby will already be here. The midwife who's been with you throughout will also be here, but there'll be a recovery nurse who will take over your care while you're here. You'll be here for about an hour. If you have any questions to ask during that time, the midwife will still be here with you, so there'll be plenty of people to answer any questions. So during this time, the midwives will encourage skin to skin, which is a lovely time to share with your baby. And once you get to the end of your time in recovery, there's no need to move baby. If baby's happy and baby's comfortable, you can keep baby on your skin as you travel back through to labour ward where you came from.